Hi, this is almost everything you'll need to know about the humerus. The humerus is the bone of the arm. We're looking here at the right humerus, and the humerus is a long bone, which means that it has a shaft and it has proximal and distal expanded portions at either end. The proximal expanded portion features this hemispherical articular surface, which is the head of the humerus, and the head of the humerus articulates with the glenoid cavity or glenoid fossa of the scapula to form the glenohumeral joint or shoulder joint. The neck of the humerus is this area here, which is barely constricted, just lateral to the head. The anatomical neck of a structure in relation to a joint is defined as the area where the joint capsule attaches to the bone. And on the humerus, that's this area here. So that is the anatomical neck of the humerus. The more aesthetic idea of a neck is the narrowest area, which is this area here. And because that's the area where the bone is most likely to fracture, in the humerus we have a surgical neck. So a distinct surgical and anatomical neck in the humerus. In between those two necks are these prominent tubercles, which are the greater here and lesser here tubercles of the humerus, and in between them is an intertubercular groove. And we'll revisit this area later on in the video. Considering the distal expanded portion now, most distally we have the articular surfaces for the two forearm bones. This more medial surface was pulley-shaped and is named the trochlea, which means pulley in Latin or Greek. And that is the articular surface for the trochlear notch of the ulna, the more medial of the forearm bones. This almost spherical articular surface is called the capitellum or capitulum, which is Latin or Greek for little head, and it is the articular surface for the radius, specifically the head of the radius, which is the lateral of the forearm bones. The radiocapital joint and the trochlear joint of the ulna are a hinge joint, a combined hinge joint. So allows flexion and extension only at the elbow. Either side of the condyles, we have epicondyles. Here a very prominent medial epicondyle, and that is the site of attachment of many of the flexor muscles of the forearm, so it is also known as the common flexor origin. The lateral epicondyle is similarly the site of proximal attachment of many of the extensor muscles of the forearm, so it is known as the common extensor origin. Particularly above the lateral epicondyle, we have a prominent ridge of bone, which is the lateral supraepicondylar ridge, which is the site of attachment of a couple more important muscles that extend into the forearm. There's a less prominent and less functionally important medial supraepicondylar ridge also. Immediately superior to the condyles, we have these depressions or fossae. This more medial, very deep fossa is the coronoid fossa above the trochlea, and that's to house the coronoid process of the ulna when the elbow is flexed, and this above the capitellum is the radial fossa, which houses the head of the radius when the elbow is flexed. We'll turn now to a posterior view of the humerus here, and again we see the head, and this time only the greater tubercle because it projects laterally. The anteriorly projecting lesser tubercle is obscured. We can perhaps appreciate a tuberosity here somewhere down the shaft of the femur, which is the humerus, which is the deltoid tuberosity, and that's for the distal insertion of the deltoid muscle, which is a powerful muscle that moves the arm at the shoulder joint. More distally, we see the less prominent lateral epicondyle here and the more prominent medial epicondyle. The capitellum is not well seen posteriorly, but there is a large posterior articular surface of the trochlea, and again immediately above the trochlea is another deep fossa, which this time is the olecranon fossa, which houses the olecranon process of the ulna when the elbow is extended. We'll look closely at the proximal humerus now. firstly from the posterior aspect, and we can see the greater tubercle in a little more detail, and can perhaps just make out three facets on the posterior surface there, and these are for the three dorsal rotator cuff muscles, the muscles that originate on the dorsal aspect of the scapula, and they are supraspinatus here, infraspinatus, and teres minor in that order. So supraspinatus, the most superior of the facets, the supraspinatus muscle distal insertion attaching there, infraspinatus in the middle, and teres minor, the most inferior and posterior of those facets. We can also see, it's just somewhere along the shaft here perhaps, a groove in the surface, and that is spiraling from medial here to lateral, and that's called the spiral groove, and because it houses the radial nerve, it's also called the radial groove. So the radial nerve escapes the axilla and enters the spiral groove or radial groove and runs essentially touching the bone, and it makes its way from medial to lateral and from anterior-ish to posterior, and to gain access to the posterior compartment of the arm, where amongst other things it supplies the three heads of the triceps muscle, the major muscle of the posterior compartment of the arm. We'll look now at the anterior surface more closely of the proximal humerus. Again, noting the prominent, prominent greater tubercle and the lesser tubercle. As I've said, the greater tubercle is for the attachment of the dorsal rotator cuff muscles, those three dorsal muscles. The lesser tubercle is for the attachment of the one remaining and only anterior rotator cuff muscle, which is the subscapularis muscle, attaches to the lesser tubercle in this area of bone and just inferior to it. The intertubercular groove is deep proximally, but shallows out as it progresses down the shaft. It is also, these sides of the greater of the intertubercular groove, the one related to the greater tubercle is the lateral crest of the intertubercular groove, and that related to the lesser tubercle is the medial crest of the intertubercular groove. Those crests, as the groove becomes shallower, give way to or are renamed lips of the intertubercular groove. So medial and lateral lips of the intertubercular groove more distally. The intertubercular groove is also known as the bicipital groove because the tendon of the long head of biceps, the proximal tendon, that at its proximal origin, runs in the groove. So we'll draw it. Its origin, you may recall, is the supraglenoid tubercle of the scapula, and it runs across the head of the scapula inside the joint capsule, and then enters the intertubercular groove and runs in the groove. So hence sometimes called the bicipital groove. And as the crests of the groove give way to being called lips of the intertubercular groove, this is the site of attachment of another three very important muscles, very strong movers of the arms, and attached at this point to give maximum purchase and strength of arm movements at the shoulder. And they are one muscle each from each of the groups of the shoulder girdle or pectoral girdle. So medially, attaching to the medial lip of the intertubercular groove, we have the scapulohumeral muscle teres major. In the floor of the intertubercular groove, we have the posterior axio-appendicular muscle latissimus dorsi attachment, and on the lateral lip of the intertubercular groove, we have the attachment of the anterior axio-appendicular muscle, which is pectoralis major. So this area, and we can also see the deltoid tuberosity here, is a very important area for attachment of muscles that strongly move the shoulder joint, move the arm at the shoulder joint. I have one more image of the humerus to show you, with it articulated with its neighboring bones, the scapula superiorly and the radius and ulna inferiorly. I have little more information that I think you need to know. That's everything you need to know about the scapula, the humerus, sorry. So enjoy this picture and enjoy the rest of your day.